Dr. J is prepping this patient for some liposuction. This patient came in for a tummy tuck, a BBL, and some lipo 360. Let me know if you guys have any questions. As I mentioned, we're just getting started. We got a busy day today. Dr. Jeneby has 3 cases lined up for this Tuesday. So this first case, like I mentioned, the tummy tuck, the BBL, lipo 360. We have a second case that is just a local procedure, and that is going to be removing some breast implants. And then the last surgery of the day has a lot involved with it as well. There's going to be a brachioplasty, axillary-plasty, and a few other things as well. So we've got a busy day. We're going live on all platforms for this patient's case. So we're on YouTube, we're on Instagram, and we're here on TikTok as well. And then for our other patients, we'll likely go live with some of them as well. So stay tuned. Again, if y'all have any questions, we'd like to go on lives to give you guys a chance to interact. And as you can hear, Dr. J is on the other side of your screen, essentially. So we'd like to open up this time for questions and just to engage with y'all, really. And I know every now and then we come up with some issues when it comes to the comments and the comments getting filtered. There are just certain words that will likely flag your comment, so just an FYI.
1.5 and 1.
For these lives, there's a lot of guidelines that we have to follow. And so it's outside of my control to unfilter those comments, unfortunately. So just letting y'all know now, if you guys comment a question and I don't see it, it's not because I am ignoring it, it's simply because I don't see it. It's not popping up on my screen. Just wanted to give that disclaimer. And so again, we're on all platforms today. Here in just a moment, Dr. J is going to get started on some liposuction. So what you probably heard in the background was a tool that's used to help prep the body for liposuction. So essentially what it does is it makes all that fat that's going to be removed by liposuction, it makes it easier to suction up, if that makes sense. And so now Dr. Jeneby is about to get started with that lipo. So this patient is getting just liposuction on her abdomen. She's already a very fit young woman, and so with her wanting a BBL, they're having to pull a lot of, basically all of her fat from everywhere that they can. So on her abdomen, on her stomach, around her sides and whatnot. Then what's going to happen is she's going to be flipped over, and more fat is going to be suctioned. And that fat is going to be held on to. If you're on YouTube, you can see the little tube that it's going to be sitting in. Basically, we hold on to that fat or the BBL. And so as you can hear in the background, Dr. Jeneby has gotten started on some liposuction. And as you can see on YouTube as well, all of that fat is going to be just stored right in there, in that little tube. If you are interested in watching this patient's procedure live on YouTube, you can join us at Dr. Jeneby Plastic Surgery, or you can find the link for our YouTube in our link tree. And hope everybody's having an amazing Tuesday.
$100, Laura.
And let me know if you guys have any questions at any point about any of the procedures. We can get you information. We can talk about things here on this live pertaining to all
Alexa,
things
turn it up.
plastic surgery, pricing. We can give you information about post-op and pre-op, or if there's certain topics that you don't think are discussed enough or there's not a lot of answers on when it comes to plastic surgery. We'd love to talk about those as well. I've had a lot of patients come on our lives and asking questions about certain specific conditions that they may have and whether or not they're still eligible for surgery. Hey, that's a great question, Nikki. Is it better? Hey, Dr. J.
Hey.
Is it better to be awake or under anesthesia
Oh,
during?
man, under anesthesia.
Yeah, right.
Man, you don't feel anything. It's awesome.
There you go, Nikki.
Awake has its drawbacks, big time.
Yeah. There you go, Nikki.
I know doctors push it because they're quote unquote safer, but with today's advances in anesthesia, you have more of an issue with driving your car to work to have an accident than you do an anesthetic. Much higher.
Yeah.
Right, Doc?
Right.
150 right flank, 50 axilla.
Yes, Miss Nikki.
Oh man, I would go to sleep in a heartbeat every time.
Yeah.
No way. I mean, we'll do it for you awake, but
Yeah, there's Nikki, there's only so much that they can do while you're awake even. There's no way you could go under super invasive procedures without going under. Today we actually have a local case. Dr. J has a local case. That patient is having a implant removal. And so for things like that, where they're just having to take out the implants, they can do that under local. They can do some liposuction under local as well. But even then, they have to break it up into segments. So, doing the front at one time and then waiting another time to do the back. And so there's a lot of drawbacks when it comes to doing local or not going under. But that's a great question, Nikki. Hey, Dr. J.
hey,
This patient had a breast lift a year ago. She says her boobs are kind of boxy. If she adds implants, will that fix it?
in general, it does probably revision lift with implants. So once you put something circular in there, it adapts to the circular portion of the implant, and then kind of a tightening around the implant. So revision lift, 150/50 on the other side, Doc. Yeah, so add an implant. Talk to us today, get in a virtual today, we have space. For a couple of consults today.
Got it. Yeah, Kim, we'd love to discuss further. We can set up a virtual consultation with you if that's something that you're interested in doing. As you heard, I don't know if you caught everything, but Dr. J said that there is benefit to having implants. Your breast will, the skin will kind of grow around it, and will kind of form to that circular shape that's in your breast, so it can yield to a less boxy appearance.
45 blank.
But again, we'd love to get in touch with you. You can visit our website at Dr. Jeneby Plastic Surgery. We have phone number listed there. I see that you're from YouTube, so if you just type in the user on our YouTube, we'd love to get in contact with you. Is anesthesia similar to an epidural?
It's not regional. It's a complete amnesia, complete relaxation. Don't remember anything.
Yeah, I mean, you don't want, not always the greatest thing to have an epidural. You do have issues with epidurals.
Okay.
And also spinal only lasts a couple of hours. So just trust us. And Dr. Hernandez has been doing anesthesia over 30 years. Probably
Wow.
older than you that's asking the question. And he is very, he's good. He's done my family members.
Wow.
He's done almost everybody in this building who wants surgery.
Really?
Yep.
Wow.
So he has a perfect track record.
Awesome. Yes, Miss Nikki, if you heard that, it is not. No, you're totally fine. I want to get lipo 360 with my arms. Yes, we'd love to set up a consultation with you. We'd love to answer more of your questions. If you want to hop on a phone call with us today or whenever works best for you. I went ahead and just pinned a form. Essentially, what that form does is it helps us get in contact with you. So once you submit it to our team with all your information on it, we'll reach back out to you and we're able to discuss more accurate pricing information. We're able to kind of discuss
Hey, Doc.
the surgery of your
Point
interest.
5.5. We're going to
Yeah,
start moving to Flipper.
Okay.
Get on again. Give him 30 seconds.
Okay.
Tell them we have our specials of the month. And anybody who books a virtual today will get 30% off their surgery, but they have to go today.
All right, so you guys heard that. If you book today, a consult today, we'll give you 30% off. Go
Just
ahead
today.
and just today. So go ahead and just reach out to us. You guys can start by filling out this form here, pinned on your screen. And Nikki, I'd love to get in contact with you. We have some exciting specials coming up this month and next month, so definitely take advantage of those while they're still around. And we'll see y'all here shortly.
I'm good.